Hello everyone. In the previous video, we studied about the calcium homeostasis, phosphate homeostasis. We studied the parathyroid hormone, calcitonin, vitamin D, and other hormones which affect the calcium levels and phosphate levels in our body. So when we studied parathyroid hormone, also we studied about the parathyroid hormone actions, right? So whenever there is an increased activity of parathyroid gland or decreased activity, we call it hyper and hypoparathyroidism respectively. According to when PTH is high or low, there will be hypercalcemia and hypocalcemia. And then whenever we know that the parathyroid hormone is very much necessary in the activation of vitamin D, the actual formation of 1,25 dihydroxycholecalciferol, which when it is not formed, there will be vitamin D deficiency. So in the other slides, we will see what are the effects of this deficiencies or excess levels of calcium or vitamin D or parathyroid hormone. Firstly, to start with, hyperparathyroidism. There is primary hyperparathyroidism, secondary hyperparathyroidism, and tertiary hyperparathyroidism. So as we studied in the previous video, we studied the calcium homeostasis, phosphate homeostasis. We studied different hormones that regulate this calcium and phosphate levels, like parathyroid hormone, the calcitonin, the calcitriol or vitamin D, right? So we will now study whenever there is an alteration in the levels of either parathyroid hormone or vitamin D and therefore the calcium. What are the clinical features going to be? How is the patient going to present to you with? So firstly, we will study about parathyroid hyper or hypoactivity, and under which we study hyperparathyroidism. So from the name, you know, hypoparathyroidism is excessive activity of parathyroid gland. So the division goes like primary, secondary, and tertiary. So when do we call it the primary hypoparathyroidism? Is when there is autonomous overproduction of parathyroid hormone. When will that happen? Whenever the parathyroid gland is more in amount, meaning there is hyperplasia of parathyroid tissue or there is adenoma, right? Then there is secondary hyperparathyroidism. Secondary, so from the name, you know, it is secondary to something. So what can that something be? It can be whenever there is prolonged hypocalcemia. So you know that hypocalcemia is going to stimulate the parathyroid gland to secrete excess of parathyroid hormone. So in cases of chronic kidney disease, okay, there is excessive hypocalcemia which is happening. Therefore, that can keep stimulating the parathyroid hormone, resulting in compensatory hypersecretion of parathyroid hormone when we term it as secondary hyperparathyroidism. Likewise, we have this tertiary hyperparathyroidism. So what could this be? It is when there is persistent hypersecretion of parathyroid hormone even when you correct the prolonged hypocalcemia. Okay, like for example, the renal transplant. So following renal transplant, there will be tertiary hyperparathyroidism. So what can be the signs of hyperparathyroidism? So when there is hyperparathyroidism, what happens is a compensating to increase PTHs, increase in the blood calcium levels, right? So now, if there is increased parathyroid hormone, what is it going to do? It is going to cause excessive bony resorption. So if there is excessive bony resorption, there will be excessive loss of calcium from the bone into the blood. Therefore, there is increase in the blood calcium level. But what is happening to the bone? It is being resorpted. Therefore, at the level of skull, there is decalcification. And when you take an X-ray image of the skull, you can see it in the form of salt and pepper skull. Okay, and there can be adenoma of parathyroid if it is primary hyperparathyroidism. And in the other bones, you can see osteitis, fibrosa cystica, and there will be subperiosteal resorption of the bone. Now, when there is increased calcium levels in the blood, what do you think will happen? Don't you think the calcium starts getting accumulated in all the other organs of the body? Yes. So it is being resorpted from the bone and is given to the blood. And from there, it reaches all the other organs and gets accumulated in the other organs. For example, there is lungs calcification. There is calcification around the pancreas, which causes pancreatitis. There can be peptic ulcer because of that. Then there will be nephrocalcinosis, that is accumulation of calcium in the kidney, resulting in kidney stones. Therefore, whenever there are kidney stones, what happens? The urine excretion is obstructed. That means more and more of urine formed is being stored in the kidney. So that results in renal infections, and further it can lead to renal failure. Right? It also leads to muscle atrophy. So you can see the radiological findings of hyperparathyroidism. As I told you earlier, the skull gets the salt and pepper skull. It looks like that. And then here you can see that there is subperiosteal resorption. Okay, you can see that there is subperiosteal resorption of the phalanges in the index and the middle fingers there. Okay. You can also see that there is loss of this lamina dura. Okay, can you see? Can you just compare between the two images? There is loss of lamina dura in the teeth, right? So what are the presenting symptoms of hyperparathyroidism? The presenting symptoms will be, it can be divided into neuropsychiatric, cardiac, and systemic. The neuropsychiatric symptoms could be depression, lethargy, and also seizures at times. There can be weakness and fatigue. Cardiac symptoms, so when there is more calcium available there is less time for relaxation. Therefore, there is shortened QT interval. There is hypertension, aortic or mitral valve calcifications, because in hyperparathyroidism, there is more of calcium in the blood, right? So it starts accumulating in all the organs. Likewise, it also accumulates in the heart. Where exactly is? In the valves specifically, when it results in valvular calcifications. Okay. Then systemic symptoms could be weakness, weight loss, anemia, anorexia, pruritus, and other ectopic calcifications. Next, coming to hypoparathyroidism. So when it was hyperparathyroidism, we studied it under primary, secondary, and tertiary. In hypo, we can call it acquired when say there was a thyroid cancer or thyroid adenoma or something. So they removed the thyroid tissue. With the thyroid tissue, maybe even the parathyroids were removed. So it can be an inadvertent consequence of a surgery, or it can be due to genetic abnormality. Maybe their parathyroids weren't formed or developed at all. Okay, so that can lead to hypoparathyroidism. So the main feature here is that the parathyroid hormone is less secreted. So when parathyroid hormone is less secreted, there is low calcium in the blood, which is called hypocalcemia. That leads to multiple symptoms and signs, and one of which is mainly tetany, which is neuromuscular irritability. So when here you see that the nerves and muscles are highly irritable stage. Okay, so what happens is that there will be circumoral numbness or paresthesias of distal extremities, and there can be carpopedal spasm. So when I say carpopedal spasm, carpo is metacarpal bones. Okay, so there is a spasm, meaning there will be flexion at the elbow joint, okay, flexion at the wrist joint, and extension at metacarpophalangeal, flexion at metacarpophalangeal joints, and extension at the interphalangeal joints. I'll show you the picture in the next slide. There can be laryngospasm, there can be generalized seizures. So the main important signs that we look for in hypoparathyroidism or hypocalcemia are Trotsky sign and Trousseau sign. Okay, so this is what I told you about the carpopedal spasm. Okay, you can see that there is flexion, initial stages of hypoparathyroidism or hypocalcemia. You will see flexion at wrist joint, flexion at metacarpophalangeal joints, and hyperextension at interphalangeal joints. Okay, so if hypocalcemia is untreated, then there can be flexion and extension of different joints all over the body. Okay, in Chvostek's sign, what we do is whenever you tap over any of the branches of facial nerve on the face, okay, there will be, the nerves are hyper excitable and muscles also, right? So there will be excessive tapping. So when you just give a small tap on the along the branches of the facial nerve, it gets irritated. So you can see multiple tingling and twitches, muscular twitches on the face, facial muscles. That is Chvostek's sign. So the Trousseau sign, there is, as I said earlier, there can be hypertension, right? So whenever you increase the blood pressure of the patient to, say, just some mm of Hg higher than the systolic blood pressure for 2 to 3 minutes, say 2 minutes, okay, there can be carpopedal spasm. Okay, it gives rise to carpopedal spasm. So that is called as Trousseau's sign. Okay, so hypocalcemia, when I said, it clinically manifests when the calcium levels are less than 6 milligrams per deciliter, and it is highly lethal when it goes to less than 4 milligrams per deciliter. Right? So yeah, the features are same as that of hypoparathyroidism, that there is perioral numbness, paresthesias in the distal limbs or digits, and there are muscle cramps. Same signs go for it, that is Chvostek's sign and Trousseau's sign. So here you can see, this is the normal ECG. Look at the QT interval there and look at the QT interval in hypocalcemia. It's been prolonged, right? Then there can be laryngospasm. Okay. Then here you can see that I said hypoparathyroidism or hypocalcemia results in convulsions. That is generalized tonic-clonic phase of convulsions you can see. So if it is not treated at the earlier stages, it can result in fatal tetany, where you can see not only flexion in wrist joint, but there is flexion at the level of elbow joint, there is flexion at the level of hip joint, but there is hyperextension of metacarpophalangeal and distal lower limb joints, resulting in this kind of posture of the body that is fatal. Right. So next is vitamin D deficiency. Okay, so the vitamin D deficiency can be there whenever there is deficiency of parathyroid hormone. Or why? Because parathyroid hormone is necessary for the activation of vitamin D in kidneys, right? But it can also be there in liver abnormalities, because one part of activation also happens in liver. It can also be there in kidney abnormalities. It can also be there in skin disorders. Okay, so in case of vitamin D deficiency in children, we call it rickets. Okay, there will be rickets. So what are the features of rickets? You will see excessive bowing of the legs. Okay, you can see enlarged abdomen in the kid. There will be rickety rosary of the ribs. And then there is something called as Harrison groove between the ribs. There will be kyphosis at the level of spine. The chest looks like the tunnel when it is called the pigeon breast or the chest. Then obviously, whenever there is deficiency of vitamin D, it results in dental defects and bony abnormalities. Along with that, there will be frontal bossing and there will be impaired hair growth. Okay, so when you take a radiological picture of the rachitic hand, meaning in a child with the rickets or vitamin D deficiency. If you take an X-ray of hand, okay, you can see that there is decreased bone density in the metacarpal and also in the in phalangeal areas or the proximal phalanges. Okay. So in adults, it manifests as hair loss. Then there is osteoporosis. There is muscle weakness and pain. There can be hypertension. There can be depression. There are many other features that vitamin D deficiency could present to you with. It can be reproductive. When they say infertility can also be there. They say even the heart attack. There can be coronary artery diseases in vitamin D deficiency. There are multiple correlations with the vitamin D. So this is about the applied aspect. So these are the references for both calcium homeostasis, phosphate homeostasis, parathyroid hormone, actions of calcitonin, actions of vitamin D. We studied applied aspects under hyperparathyroidism, hypoparathyroidism, hypocalcemia, hypercalcemia, vitamin D deficiency, right? Thank you.